All right, hi, I'm Morgan. I'm going to be your student physical therapist today. Can you just state your name and your age?
Good morning, love. My name is Benedict. I'm 60 years old.
Okay. Can you talk about what brought you in today?
So I'm coming in because I've been having this pain like right here in my crotch area. And it's really on the right side here, but it's kind of recently or over time, it's kind of worked its way around kind of into my rear a little bit too.
Okay, when did this start?
So I'd say it's been going on for a while. I'd say I first started noticing it about 3 years ago, and it's progressively just gotten worse. It's kind of moved from the front here, it's kind of expanded around the side.
Okay, so it gotten worse over time. Can you describe what kind of pain it is?
I'd say it's pretty sharp in the joint here, and then I'd say that it kind of just, it spreads around to a little bit residual, but really right in the hip there, it's sharp.
Okay. Can you talk about activities that make it worse?
Yeah, so anytime I'm on my feet for a prolonged period of time, I like to go out on the pitch and kick the football with my mates. So doing that for a long period of time, getting a lot of movement in that hip, standing on it for a long time, really aggravates it. Gets my dogs barking.
Okay, and then what about things that have you found to make it better? Activities or just methods that you've tried to reduce the pain?
So in general, I'd say that really just like resting it, but only for a little bit of time. If I rest it for, like half hour, a little bit longer, it's pretty good. It goes down a little bit. But if I'm like really resting for a long time, if I spend quite a few hours on the couch or I wake up in the morning, it really stiffens up and locks up, and that just makes it really hurt.
Okay. So when that happens and it stiffens up, how long have you found that it takes for it to kind of loosen back up?
Generally, I'd say probably if I'm really moving it, if I like try to baby a little bit, it'll last a while. But if I really just get up and I get moving, usually takes like a half hour to kind of really just loosen up. And I still feel that pain, but I'm not having as much stiffness anymore in there.
Okay. So do you feel like this pain has really limited your ability to walk or do the activities that you're wanting to do?
I'd say, yeah. Like if I want to go out, like I said, I like to go out, kick the football with my mates.
Yeah.
I just can't keep up with them anymore. I can't get as much power without really hurting myself. I can't go as long as they can. If there's some younger blokes on the pitch, then they school us. I'm not the same as I used to be.
Yeah, I'm sorry to hear that. And just curious, are you retired now?
I am, yes. I've been retired for the past, I'd say, 5 years.
Okay, and what are you retired from?
I used to work in a pub, so it was a lot of, not just behind the counter stuff, but in the back, really bending over, lifting up the kegs, plugging them in, a lot of unloading the truck, getting the supplies out, all kinds of stuff like that.
And you did that for a long time?
I did, yes. It was a career move for me.
Okay, all right, so just a couple questions that I have for you that we ask everyone. Just to kind of rule out anything else that might be going on. Have you had any recent weight loss?
Oh no, I wish. I've actually put on a couple pounds recently.
Okay. Any issues going to the bathroom?
Nope.
Okay. Does the pain radiate anywhere else? Down your legs or anything like that?
Not really. It's gone around the side a little bit, but it hasn't progressed past my hip.
Okay. And do you ever get any numbness or tingling sensation?
No.
No.
I'll get a little tingle in my hands before a big game, but nothing out of the ordinary.
Okay, and no fever, pain at night?
No.
Any night sweats?
No.
Okay, all right. I think that's all I have for you. So epidemiology for hip OA, your patients will typically be older than 50. They can be obese. There can be a genetic factor. And then their occupation, either previous or current. So it could be high impact physical activity. Our patient worked in a pub and was doing a lot of manual labor, or they could play high impact sports. And then typical subjective findings, the patient will complain of either anterior or lateral hip pain in the groin area with weight bearing activities. And then morning stiffness that lasts less than 30 minutes, which is what our patient presented with. It can be sudden or more of a slow onset that's worsening over time. In addition to the morning stiffness, there can be pain and stiffness after just sitting or resting for long periods of time, and then pain that will worsen with vigorous activity. Our patient was playing sports with his friends, And then that stiffness may be affecting your ability to walk or to bend. All right, so next we're gonna go through just some tests and looking at kind of what happens when you move. So the first thing I'm gonna do is just take you through some motions. I want you to tell me what happens to your pain or any other symptoms that you might feel, okay?
Okay, love.
All right, so I'm gonna bring your leg up nice and slow. You tell me what happens. Is that painful?
That hurts, yeah, that's
Okay.
right there.
And then what about if I bring your leg up?
All right, all
All right, that's enough of that. I won't do any more. Now I'm just gonna check on the other leg. He has no pain. So now I want you to lay on your side.
All right.
And I want you to try and lift this leg up just a little bit. Is that a little
That
painful?
hurts, yes.
Okay, I'm just gonna lightly press. You tell me what happens. Okay, all right. Okay, you can relax that down. And I want you to, I would test the other side, no pain or weakness with that. Lay on your stomach. Now, can you try and lift your whole leg off the table? Okay, good, that side looks good. And then don't let me, keep it up there.
Sorry.
Don't let me push it down. Good, okay, and then relax. Now we're gonna try the same thing on the other side. And a little bit of pain there.
Yeah.
And then I'm gonna lightly press. Okay. All right, now can you come to sit at the edge of the bed for me? And then I would test, I'm gonna test hip flexion. So can you just try and lift this knee up to my hand? Good on that side, now this knee. Okay, some pain. So typical objective findings for hip OA can include decreased hip range of motion, which can be limited either by structure or by pain and symptoms, which we saw with our patient, as well as decreased hip strength. We didn't show it in the video, but they can have an antalgic gait. There can potentially be crepitus with movement, and then specifically pain with passive internal rotation, which I don't know how well you can see in the video, but our patient did have pain with this.